तो सर नमस्ते।
नमस्ते नमस्ते। बोलो सर।
तुमने बात किया था पेशेंट था हमने
हाँ।
देखो वाला लिखता है, मुझे पता नहीं था तो
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 बुकिंग इज कैंसल्ड, रिफंड अमाउंट एंड वॉचर्स
हाँ वो कितना
क्रेडिट।
रिफंड आया सब
वो तो
बोलो।
बाद में आएगा ना सर, जब सब।
दिखता ना अमाउंट दिखता ना आपको कितना आया, क्योंकि उनकी तरफ से ये हो गई कैंसर।
अच्छा
तो
अच्छा।
इसलिए अपन बोले अभी
फिर
रजिस्टर
वो
से
पूरा मिल
करेंगे।
जाएगा कुछ
सुनो
तो।
भाई, इधर रजिस्टर में कुछ नहीं काटते, पहले वाले तो पूरा दे रहे, तो इसमें कहाँ दिख क्या है तो
नहीं है
मुझे
सर।
पता ही नहीं था, बहुत कर रहा हूँ।
अच्छा।
हम्म,
सर कैसे
पूरे आ रहे हैं ना,
रिफंड।
बढ़िया। वही मुझे पता ही नहीं था रिफंड अमाउंट, नो कैंसलेशन की।
हाँ।
अभी पेमेंट करना पड़ेगा उनकी तरफ से, पोस्टपोन हो गए, देखो आए पैसे आ
अच्छा।
रहे।
हाँ।
कितना
बड़ी।
फास्ट है ना, अभी 16,000 रुपये में, ये जाने की फिर वो आने की। वो मुझे समझ रहे नहीं कैसा करना।
अच्छा अच्छा।
तो फिर मैं गया साइट पे,
हम्म।
इंडिगो के,
अच्छा।
देख रहा, हो गया सब, अभी ट्रेन के करना पड़ेगा। उनकी तरफ से कैंसिल हो रही फ्लाइट, तो अपन पिकनिक अपना गड़बड़ हो जाएगा।
कहाँ पे?
तिरुपति का, औरंगाबाद, हैदराबाद, तिरुपति
अच्छा
आते टाइम, तिरुपति नवी मुंबई, औरंगाबाद।
अच्छा।
Dr. Sridhar, can you mute yourself, please?
हाँ हाँ।
तो पैसे
Dr.
भी आ रहे हैं।
Sridhar,
बरोबर आ जाते सर, कोई प्रॉब्लम नहीं
हाँ।
रहता।
नहीं, वो क्या है, मैंने बुक नहीं किया था ना, इसलिए मुझे
so good evening all. Am I audible? Dr. Raju, Kalyan Shettar sir.
Yes, you're audible.
Yeah, I think all hospitals are studded with influenza. Even today I had more than 10-15 admissions. So far, any doubts regarding previous classes? Anyone? We'll wait for 5-10 minutes so that we can start. Dr. Jayasri, Dr. Kalyan Shettar, Dr. Praveen, Dr. Sridhar. You can unmute yourself and talk. Any doubts, Dr. Namrata? I think Namrata is, hello?
Sir,
Sir, it was earlier. Again, I have sent one more link in the group.
yeah. Sir, sorry. This is actually my mobile. My daughter is using, sir. She is using this one.
Madam,
Her
1
name
minute.
is
Namrata, madam, 1 minute, please.
Yeah. That's what, sir. Yeah.
ఎంటర్టైన్మెంట్ కి ఓజీ ఇక్కడ
బంగారం అమ్మేయడమే మంచిది కదా తాకట్టు పెడితే టెన్షన్ ఉంటుంది కానీ మిగిలిన టెన్షన్ మొదలవుతుంది ఇంట్రెస్ట్ ఇన్స్టాల్మెంట్ రీపేమెంట్ ఎక్కడ కొన్న బంగారం జాయ్ అకౌంట్లో అమ్మేటప్పుడు బెస్ట్ దొరుకుతుంది అది కూడా 15 నిమిషాలు బంగారం కొనాలన్నా అమ్మాలన్నా జాయ్ అకౌంటే బెస్ట్ జాయ్ అకౌంట్ ఫేవరెట్ యూ
Yes, madam. Sorry. Madam? So morning, accidentally, I sent the link of 19th August. But I have put a recurrent meeting. Somehow that Zoom has not taken up. So I made a new meeting. So for any doubts regarding basic foundations of artificial intelligence, ethics, responsibility, security, any doubts? All of you have gone through the videos, recordings? Dr. Fonmi Ogamaya? Yes, sir. Any doubts so that before we start the class? Dr. Kalyan Shettar, Dr. Pawan, any doubts?
Sir, no doubt,
Okay.
sir.
Okay.
Till now.
It's good. We are going very good. So this week is mainly we are going to make you some of the tools which can be used in your day-to-day in your clinics, either to documentation or to make the diagnosis, to make some nutritional diet, good diet chart for the patient, a proper discharge summary. All these things this week we are going to touch you upon. So this Wednesday, today, I'm going to teach you mainly the Notebook LM. It was previously called Notebook LM from Gemini. Now it is called Gemini Notebook. The terminology has been told. I'm going to introduce that Notebook LM for about 1 hour. Then I'm going to tell you about how to use these models as a clinical diagnosing supporting system. I think if you can check in your mobile, your WhatsApp group Random Forest, I have sent a beautiful today's case that in our Karnataka academic group. I think Dr. Gauri is also there in that group, I think.
Yes,
So
sir.
a beautiful case that has been a real case from Dr. Mahesh Kore from Belgaum. So I'm going to show you by using some various large language tools and some digital AI-enabled EHRs, how the output is going to differentiate, and you can try afterwards. So that is what the clinical diagnosing supporting system. So today will be more of a hands-on rather than the theory. Okay. So all of you, if you are with your personal computer or laptop or in your tab or mobile, you can do it easily. So step by step, any doubts and all, you just intervene me. I'm going to go very slow by slow. So whole 2 hours will be mine only today. So don't worry. But next Sunday, there are 2 speakers who are going to come, very eminent speaker from India. That is Dr. Samir Shah from Vadodara and Dr. Mamta Panda from Bhubaneswar, Orissa. Both are pediatrician. They are A enabled. They have got a lot of certificate courses from very reputed institution. So they are going to show you how to use this ChatGPT, Gemini, Claude as a good documentation, A-enabled documentation form, how to make out the discharge summary, how to customize your GPT, all those things they are going to tell you in this week. Okay. So without any much delay, we will start because already 9:10 is there. I think my audio is good now. Yeah.
Yes, sir.
So I'm going to share my screen now. So go to Google search whenever you want to assess the, so whatever the browser you are using, either Google, Firefox, Microsoft, Internet Explorer or AI browser. So this is the window. You will get Google search. Just type Gemini Notebook LM. It is coming here. So click on this icon. All of you can do with me. In your mobile also you can do. So this is the window you are going to get. Ideally you should have a Gmail account, which is a free of cost. All of you are following me. See, what is this Gemini notebook? See, Gemini notebook is nothing but, I have prepared some slides. Let me see in my comma. Yes. See, I have some contextual slides. Yeah. Is my slide visible? Anybody
Yes,
can
sir.
unmute and, yeah.
Yes, sir.
So earlier, the Gemini used to call as Notebook LM. Now they have changed their name as a Gemini Notebook. Okay. This is for the doctors, how it is going to help mainly as a AI research assistant. Okay. So I have built a 8-minute micro learning module for doctors regarding this. How to use this Gemini notebook in your day-to-day practice. Okay. So what is this Gemini notebook LM? Why it is matters to the doctor? It's a free for all Gmail account holders, and it has a pro version also. It has an enterprise version also. Those who have got the Geo prepaid SIM, it is pro version is free. So this is worth of around Google is going to give you around 35,000 rupees worth of Google Gemini along with the notebook LM. What are all the difference between the pro versus a free account? That also I'm going to show when I come to the notebook LM in detail. Okay. So this module map is 4-module map. Okay. How to get the sources for this Gemini? Either it should be a PDF from your computer or from your Gmail account, Google Drive, or from YouTube, or from the website. How to get the sources for this notebook LM, that is I'm going to tell you. Then comes the very, very heart of this notebook LM, that is chat box in the notebook LM. Then comes the very wonderful thing about this notebook LM is studio and sharing part. So you can do all these things with other ChatGPT also, Claude also. But what is the difference between them and this is it has a studio part. You can create a PowerPoint, you can create an audio podcast, you can create a video podcast, you can do infographics, you can do various things. You can do quizzes, you can do pools, all those things you can do. Okay, you can do a mind map. Okay, so this is the module, that video that I'm going to share you. It is a ready video. It is like something like a very small video of about 30 minutes. You can do whenever you are free. So coming to the module resources. So in Notebook LM, as I said you can import sources from PDF in your computers as a guidelines of Indian Academy of Pediatrics, guidelines of AAP, American Academy of Pediatrics, or BMJ, or any journal you can import in a PDF. From the Google Docs and slides also you can import. From websites and URL you can import. I'm going to show you a demo. And YouTube links also you can import, and audio files also. These are the ways you can import. And from these sources, you are going to discuss the entire thing. That means you have a very large amount of library. In that you have chosen some subject in your pediatric domain. You have taken all this 10, 15, 50 PDFs you have taken, and you have taken research from YouTube links also. Now we are going to discuss with that mini library. So why you want to discuss? You want to know what exactly is there in that 50 articles that you have taken, and you are making your own in this chat box. Okay. So this is a resource section. So I will stop sharing this slide. I will come to the demo session. All of you can open your Gemini Notebook LM. Anybody is having difficulty? Please unmute and tell me. You are getting this create new button, Dr. Gauri, Dr.
Yes,
Guna
sir, it
Singh?
says create notebook.
Yes. Anybody has any difficulty? Please unmute. Dr. Jayasri, any difficulty?
Sir, I joined late. Can you just tell me what we have to do?
See, go to Google search button, sir. Google
Okay.
Yes.
search engine, type Notebook LM or Gemini Notebook LM. See here.
Right, sir.
Then click on this Gemini Notebook. You will get this screen. Got it? Another way is, this is your email inbox. You can click on this apps button, 9 apps button. You can scroll down. Here you have a Notebook LM. You can click here also. If you have a Gmail account.
Right, sir.
So you are now opening your Gemini, na?
Yes, sir. I'm
So
good.
Gemini Notebook is there. Create new. Okay. So once you click on this create new button, that means you are creating a new notebook. Okay. So either you can import the sources. You can click here in the add source. Okay. See, I have clicked here add source in the left side. So before that, please see, all of you attentively. See, left hand side of your Notebook LM is a source button, source window. We have 3 windows here. The left hand side, extreme left hand corner is source window, whereas the center window is called as chat window. So this I love to call it as a heart of this Gemini Notebook LM. And the right corner, what you can see here is a studio window. So you have 3 windows, dear learners. One is source, one is chat window, another is studio window. So what does this source do? You are going to import the sources, the genuine resources that what you have from your academy, from your journal, from your own notes, okay, from your books. So that you have put it in your computer or in your G drive, okay, or OneDrive if you are a Microsoft user. You have stored it, you can all import it here. In chat box, what you are going to do, once you import this source, you can chat with this resources. That is what I am going to show you. In the studio component, what you are going to do, Once you have made a chat with this, you have made a notes, you can create audio, you can create PowerPoint slide deck, you can create videos, you can do mind maps, you can do wonders, you can do reports, you can do flashcards, you can do quiz, infographic, data tables. So it has got more than 9 features. And one important thing is you can change it to any language. See here, if you click on the settings button, output language you can choose. You can choose whatever the language you want. You can choose your Kannada, English, Tamil. Okay. So for the presentation tech, I'm choosing English. Any doubt regarding this? 3 windows? Any doubt you can unmute and ask. Tell
No,
me.
sir.
So that right. So then comes adding sources. So I am going to the source button. Click on the add sources. So if you don't have any resources in your computer, you can go to the web. Okay. You can choose the web. Either you can choose fast research or deep research. So if you don't have much time, you can choose fast research and put a prompt here. It is going to do search in Google engine in Gemini. Okay, not in Claude or anything. Suppose if you have a complicated cases, if you put the deep research button, then it will search entire Google, whatever the store in the internet, and it will take lot of time. So depending on your time availability, you can do research. But I don't prefer you people should go to web and take the material. You should have your own material. In the down, you can see you can upload the files. You can take a URL website link from YouTube or from website, or from your Google Drive you can import, or you can copy text from your WhatsApp and you can put it here. That also you can do. Okay. Or you can just drag a file from different window to PDF or images or docs or audio. Okay. So now I'm choosing the uploading the file. So I will go to my academics folder. I request all of you to mute yourself unless you want to speak. You should not disturb others. So I'm choosing okay. I'm choosing some newer. Yesterday I told you, somebody is in update hours. I told you about the bacteriophages. So what is bacteriophages? These are all viruses, synthetic viruses produced from this artificial intelligence to kill the bacteria which are drug resistant. So for that, I have done some studies through these journals. Okay, I'm taking. So these are all the revolutions in infectious disease. I'm choosing these journals. Some digital culture plates. These are all newer things about. So what it is going to import all these PDFs. So dear learners, now you start importing some of your PDFs, and depending on, say, somebody is interested in urinary tract infection, somebody is infectious diseases, whatever the PDFs you have in your computer, try to import it. See, automatically it has taken the title that I have imported, AI-assisted interpretation of blood culture gram stains. In this this thing. Then I will add one more sources. Go to upload. This also I'm uploading. Let me see. So up to 50 PDFs you can upload. In case of storage, around 250 to 300 or 400 MB you can upload. Okay. See, now it is asking, you can select both, or you can select all, or you can select only one also. Okay. This is your choice. Any doubt till now? Any doubts you have?
No, sir.
Now we are chatting with these two PDFs. See, you have to read this AI-assisted interpretation of blood. So this is there in this paper. You have to read this. Okay. If this is good for you, you can click here, or you can pin this. It will be there. Now it is asking the follow-up question. How does AI-assisted interpretation compare to manual microscopy result? What are the biggest challenges? Teach me how BCA system classifies different. Let me go to this. This is some automatic system, BCA, bacillary count automation system. This is the advanced microbiology, dear friends. Just to teach you, I am telling you, I am not taking the common things. This I was taken when I was able to present a talk on what are the revolutionary changes of artificial intelligence in infectious disease in a pediatric state level conference. See, this is a blood culture application, BCA. See, this is going to give. So these are all the newer things. Okay, don't worry about the content, but you have to read it. See, it is asking save as a note. If you find in this paper, this is a very good thing, you are making it saving note. Once you click on the saving note, you just see here in the right hand side, just I am moving this window here. You can see here in the right side, this notes, mini notes is coming here. To simplify all of you, you have a big library here. It is giving you the conclusions or summary here. Here you are discussing and making your own notes. So just before exams, you are going to read the small notes. No? Whenever you are in MBBS or PG, you used to read big books like Nelson and all. You are making your own notes in different topics. And previous day of exam, you are not going to open the Nelsons unless you are doubt. You are going to make your own notes, and your same way you are using now the notebook LMR, AI assisted Gemini notebook LM. Okay. See, this is what Dr. Avnish was telling about agentic system. See, here it is suggesting me I could generate a interactive quiz based on these classification categories in the clinical reasoning. So if you are in a medical college, if you want to generate an interactive quiz, you can just copy it and you can ask. It is going to give. Say I am copying this. So you paste it here. Depending on the two sources, it is going to generate a interactive quiz. You need not have to go to studio also. Here only it is coming. See, this is a built-in agentic system. See, it is start generating quiz in the studio. So it is asking, once you have taken the quiz, we can dive deeper into the scanner hardware workflow or look at the performance results of AI system compared to human expert. That means yesterday when we are showing about how to believe these AI models, no, we have to have this performance result. That is very important. Who is going to perform? We, the expert, we are going to perform with the AI model output. We are giving them a unknown cases. We are giving them the difficult cases. It should perform like a trained cases. Okay. See, now it has generated a quiz here. See, this is the quiz it has made. All of you can see 10 quiz question. because all of you have not read this article, you are not going to answer this because of lack of time. Just I am showing you how to explore the notebook LM, Gemini notebook in depth. Okay. Any doubt till now? Anybody? Kindly unmute and let me know.
No, sir. Perfect. Going on.
Very good. Any doubt, please let me know so that I will solve at that time only.
If you have generated a quiz, will it let you know the correct answers also?
Yeah, it is going to tell. See, in BCA, blood culture application, why are gram negative and gram positive consolidated into single class labeled rod-shaped bacilli? Say, for example, I will choose. See, it is showing wrong. It is telling here. You can play around, madam. Don't worry. Okay. This is one of the beautiful tools that I am using for 3 years when they released. And the very few person I started using like audio podcast. See how you can use this notebook LM. You can upload your, say for example, pulmonary PDFs you have, pulmonary latest pulmonary updates, upload it. You can just have a good chat around half an hour with this PDF, then convert into a audio podcast. Say for example, these two PDF I want to audio podcast. So it is going to, once you click on this button, it is going to ask you which format you want audio podcast. It should be a deep dive live conversation. It's a very brief one, or a critical expert review, or a debate with two hosts. You can choose the language also. And what should be the length of the format? It should be a short, default, or a long. And how many resources you want. You can choose the resources depending on your choice. So why this is very, very important? Because you have control with your resources. And all of you know Dr. Guna Singh. These are all AI models like ChatGPT, Claude, Gemini. They will give answers from vast amount of large language module data. But here, the difference between the Gemini Notebook LM is it is going to give answer from this only 2 PDFs that I have uploaded. It is not from the web. Unless you want the web, you have to tell Gemini that I want, it is going to ask you, Dr. Deepak, or you want to search more for the web. Then you go to the web here, go to the web search, then you search. Go to the deep or fast search, then you search. It is going to give you. Okay. Or you go to the ads resources, then you are going to give you. So you can create the audio podcast. So let us create a brief audio podcast. Okay. Or a deep dive with a short podcast. You can give a prompt. So what should AI host focus on this episode? So it is going to give you some hints, technical innovation. Okay. So in the PDF, it is going to tell you lab automation benefits, or you can type your whatever you want also, practical clinical impact. So now you click on the generate button. The only caveat here is, even if I give prompt, make a audio podcast of a male voice, audio podcast of female, sometimes it will give female, sometimes it will be male. That control you won't have. Okay, that is the main problem I face. So it is generating the audio overview. Okay. Then comes the slide deck part. If you want to create a PowerPoint from these 2 PDF and you have made a notes here, see here, you have made a notes here. Okay. So this also you take it as a notes. Okay, it will come into the notes also. So you can click here in the 3 button in the studio note. You can see here convert it to source or convert all your notes, 1 to 3 notes into source. So it will come to the source button. That means you have a big amount of library here. You have made a chat with that library and make a notes here. and you are converting your notes into a PowerPoint or a audio podcast. That means you are going into a precision of your research. Okay, your whatever the research you are doing with this PDF, making a mini notes, from the mini notes you are doing a studio part like audio slide deck. So now I will choose the slide deck here. Again, it is going to tell you which format you want. A detailed slide deck or a presenter slide deck, which language you want. Okay, you can choose. If you want a very short length of PPT, and now it has taken 3 sources, one from the notes, from the PDF. If you don't want from PDF, only from your source, it is going to give you. Okay, it is all your choice. And also how the PPT should contain, that also you can, if you click here. So I will tell I need slide deck by name Dr. Deepak Chiradoni for my Smart Heal Nexus Academy Random Forest Cohort 4. Okay, so it will try to create in your name. Okay, any specific from this PDFs you want, you can type it specifically. If you are doing an intervention, you type intervention. So you can ask create the newer revolutionary diagnostics in pediatric infectious diseases. Okay, so it will start create here the studio slide deck. See now, let me see, still the audio is generating. It will take little time, don't worry. So friends, now you know how to import the articles. Now I will show you how to import article from YouTube. See, if you click on the add sources, go to the YouTube here. Okay, it is asking paste the link. So for that you have to go to YouTube. Okay, go to the research button here. So I want to ask YouTube the newer revolutionary diagnostics in pediatric infectious diseases. I will search in the YouTube any material there. Interesting case of pediatric infection from pediatric on-call. Dr. Irasha's website is there. Updates on pediatric infectious diseases, it is there. So you can choose whatever it is. History taking. So all about pediatric diseases are there. But what about the diagnostics? There is there. 2 years ago, diagnosis management of pediatric osteomyelitis is there. Revolutionary infectious disease diagnosis. This is something around 10 months. Let us take this. If you find this is a good one, so what you can do, you can take it.
Hello, good evening, everyone. I am Dr. Koel, and I will be the moderator.
So just I am holding this. So copy the link. See, you have to copy this link. Either from browser you can copy, or here also you can copy. Then go to the notebook LM. Paste it here. You can paste any amount of links from YouTube if you have. See, it is taking here as a resources from the YouTube link. Any doubt how to get the link from YouTube? Anybody has any doubt?
Sir, where did you click for sharing on the YouTube? I couldn't see that. to
Just
get
a
the
minute, just a minute. I will
Yeah.
show you once again. Always best will be you have to
Sure.
click on this share button.
Right. Okay, got it.
Then it is going to give you the copy. Otherwise, you can click here also. See, in the browser also. Huh? In your browser also, Google browser. Huh?
Right. We
So
can just
control
Just
C.
copy the link and
and
paste it.
Got it.
Yeah.
It.
So these are the two ways. This will be the best. Okay, easy. So any doubt? So if you want to paste one more also, you can go. Okay. Any other cases, let us search. This is 10 years. Don't take this older ones. 11 years. So YouTube is not a good resource for newer things. But if you find any interesting articles, no, even what you can do, you can copy and paste our a link that I have sent you, no, for our last class and all. You can just copy that. Say for example, now I will copy that. Okay, I will go to the, not this one. I'll go to the home button. So my videos. So for example, we have a heavy rains here, so net bandwidth is very slow. I'm very sorry for that. But anyway, we'll wait. Any doubt till now? Yeah.
No,
See, these
sir.
are all my recordings. These are all my recordings. Okay. So if I click this, okay. I'll just open this. See, the link is here. You can see now, I have copied it. Again, I will go to the notebook LM. Again, add source. Choose this one. Why I added this? Because in yesterday's update hours, I told you about this infectious diseases. Got it? Now, you can ask notebook LM, I need input from YouTube links. Okay. YouTube links about newer aspects of pediatric infectious diseases. So now it is going to scan these YouTube recordings and it will give. So by that time, we'll go to this studio section. See, this is the audio podcast that we have seen. I'm going to.
Welcome to today's deep dive. I'm your host, and today we have a really fascinating topic.
Hey everyone, I'm the resident expert here, and yeah,
Are you listening to the
getting into
audio?
some incredible medical tech today.
Right. We're looking at a
Yes,
2017
sir.
study on agar plates and a newer 2024 study on gram stains. And the mission here is really to understand how convolutional neural networks, or CNNs, are automating bacterial counting.
Which is a huge deal. It is fundamentally changing diagnostic microbiology.
Yeah, and to picture why this is so necessary, imagine trying to count, like, all the stars in the night sky.
Oh boy.
But you can only look through a tiny, blurry telescope, and you have to do it for 8 hours straight without ever losing your place.
That sounds absolutely exhausting.
Right. But that's essentially what lab technicians do. And these studies show how deep learning is finally, taking that telescope away from the exhausted human.
It really is. Right now, technicians manually count.
So this is the audio podcast that I'm going to share you. You click on the 3 button. You can download it You can share it, you can rename it, or you can delete it. So now I'm going to share you. I'm going to anyone in the link or public. Okay. Click on the link. I'm making save. Now I'm putting in the Perceptron group. Okay. Sorry, random forest group. Okay. If you want, I can put it in the chat box also. So now you know
whether
how to create
this,
a audio.
sir,
Yeah.
any language it will pick up YouTube, Tamil, English,
Yes.
I mean Hindi,
See,
anything
I'm
it will.
telling you. Yeah, I'm going to show you. You go to the settings here. Output language. Okay.
Oh.
Select here. Just type Kannada.
No, this is output language. Suppose YouTube is in some other language.
Yes, it will take. It will take input also. See here, you can see. See, that is why it's a multimodal. Yeah. Got it.
Okay.
So slide deck, it is still generating. Very beautiful slides it will give. To make that slides, it will take months together for us. Okay, just I'm going to show you. See now, I told Gemini Notebook to I need a input from YouTube. So YouTube recordings are within your highlight several revolutionary emerging aspects of pediatric infectious disease diagnostics and therapeutics. See, I have not gone through, you have not gone through this recording. Okay. See this metagenomic next generation sequencing. This is a now in this era. Okay. So what are the newer things which are there? See, everywhere the evidence is there. See here, if you click, resource is there. That is why this is called as a research assistant. You have a references and citation. So what is the take-home message, dear learners? There is no hallucination in Gemini Notebook LM. If your resources are grounded to the truth, 100%, your web search is very good, and you have taken a very good reputed Q1 to Q4 journals from the world, you are not going to have a hallucination. That is why it is called as a big research assistant. Okay. One of the best AI tools that Google have developed in their ecosystem. Okay. So just go through this. Even you can share this chat. Okay, you can customize the notebook LM. All those things you can do it. So every time it is going to show you how many resources it is there. It is going to remind you. Okay. So what I tell you is how you should give. First, you should know how to add the sources. Okay. Always keep it sources in your computer. Because when we go to the fourth module, I will tell you how to pull the research paper from various AI tools. All this research PDFs are going to place it in your personal computer or in your Google Drive or OneNote in your Microsoft Drive. How to pull these articles into this Notebook LM, how to do this chat with these research papers, how to find out the gaps. Say for example, in this paper, I am asking Notebook LM, I need more research gaps in this studies. In or with reference to India. Okay, let me see what it is going to give. So here you are finding what more research you need from this paper. What are the deficiencies? This is helpful for an academic researcher who are in medical college, giving a topic to your thesis for your postgraduates or fellows to do DNB people for the thesis. This is how you are going to do a research gap in specific domain, especially is this in a revolutionary. That is how you can use this artificial intelligence Gemini Notebook LM to find out these research gaps. So it is going to provide you. Okay. Just play around with this notebook LM or Gemini notebook. See, it has given, when looking at the advanced diagnostic kind of covers, so these are all the research gaps. Lack of local cohort validation, that is very, very common. Okay, because most of the cities do not have this extensive metagenomic next level sequencing. Even in very, very big metros, now it is coming up. Then pediatric chest X-ray, gram stain AI, bias and risk. See, exclusion of polymicrobial specimens. See, these are all the research gaps in this paper. Yes, sir. Somebody is asking any question? Okay, it's by mistake, I think. Again, regulation and complementary. All these A models, whatever research gaps is there, it is going to provide you. So this will give you some hint that which aspect you are going to take, depending on your cost of investigation, depending on your types of patient you see, because all these are expensive investigation, cannot be for a government hospitals. So maybe some corporate hospital for a sponsor you can take. See, is asking, I can organize these research gaps and diagnostic needs into polished slide deck outline. So this is a agentic AI. This is a typical agentic AI that Dr. Avanish Kare was telling. Those who are not listened to that video, please go to that pediatric AI WhatsApp group. Please see that. And Dr. Guna Singh, maybe you must have confused. We have a small hill nexus community. Okay, it's a big community. In that we have a open community called pediatric AI WhatsApp group. Okay, that is you are confusing.
Okay.
In that 400 or 500 pediatricians, only 38 people are there in your random forest group.
Okay.
Okay, it's a huge community, smart hill. In that AI model providers are there. We have a faculty syndicate for basic. We have a faculty syndicate for advanced. We have first 3 cohort different patches. Why I have made different WhatsApp group? Because whatever I am interacting, whatever I am the links I am giving is for your proper batch. Because of effective communication, effective assignments, to take back the assignment and telling in this Wednesday who are the faculties who are coming, in the next Sunday who are coming, to giving the Zoom links, I have made that separate cohort. Now I think you are clear, Dr. Guna Singh. Yes, sir?
Yeah.
See, after reading the research gaps, you can save this as a note. Once you save this as a note, it will come into the right side of the studio. Okay. It will come here. Then it is asking some follow-up question. What makes pediatric X-ray AI datasets harder to build? So it will start digging the paper till all the papers answers are there. Okay, you can choose. So you know how to add the resources, how to chat with that. And this is the studio part. Okay. It will take this will take anyway videos and slide deck. It will take maybe 30 minutes to 3 hours. So depending on your resources, more complicated resources, it will take more time. Because it has to think, it has to reason, it has to go to the Gemini deep search. Then it will pull the articles. If it is not getting answers, proper answers, it is going to ask you, shall I go to Deepak? Shall I go to the Gemini web deep search? Shall I pull on? Otherwise, I will limit it. Otherwise, I am very sorry, I don't have the answer. Say, for example, now I will ask a irrational question. Now I will ask, what is the status of floods in Nepal as of today? Let me see. See, that is how you can test this. See how honestly it is telling your sources focus entirely on medical AI, pediatric infectious diseases. Then it is asking me, do you like me to conduct the web search? Now all of you are happy? Yeah, you believe in notebook? Put a thumbs up in the note chat box or in reaction button you can put thumbs up. See, this is how honest this notebook, LMR Gemini notebook. So everything what you are doing is relied on only the ground truth or the resources which are there here. From here only it is not, otherwise it is going to ask you. If you say yes, it is going to go. If you give a thumbs up, it is going to think I have done a good thing. You have done a good thing. So this is a factually correct, easy to understand. So this is typically what you call it as a reinforcement learning. You remember my foundation in terminology class, what I told? You have three types of machine learning. One is supervised, another is unsupervised, another is reinforcement learning. In reinforcement learning, if you put the thumbs up, it is thinking that you have given a proper ground truth answer. It will give a same results to other also with a similar search. If you give a bad search, say for example, it is go, how I am bad. Is it offensive, irrelevant? Okay. See, this is how you should play around with the chat box. So my sincere request you is, more PDFs you use, more time you have to spend with the chat box. That is a dictum. Don't think that whatever it has given a summary is 100%. Okay, it will take some gist of it, some summary of this PDF, or only abstraction it is giving. That doesn't mean that it is given a proper answer, that what you desired. That is very, very important. Hopefully I am touching you are making you understand. Any doubts?
Can
So
we
still,
upload textbooks or just there is a limitation on size for adding sources?
yes, madam. Maximum textbook it will take around 300 to 500 MB, madam.
Okay.
You cannot upload it. It has a caveat.
Okay.
Even slides also, if you have a pro version, it will give up to 10 to 15 slides. It is still generating. Let us come back later. Okay. So let me show how to go to the another question many people will ask is this what I have done the research is there with the notebook LM or not? So for that, you have to go back to this part, my notebooks. See, these are all my notebook LM since last, when it is introduced. So much is there. That means each and every day how much I'm using. See, from 2024 October when it is released, I have done so many topics. So let us take an interesting topic. I think I will take this infectious disease only, how I am made. See, this is the one. I have made a chat GPT flyer and I have added in the customize button. So this notebook will be in this thing. So here I have taken so many resources for preparation from the web. Okay. So many resources I have taken. And I have done lot of research, extensive research. Okay, all these things I'm going to share you. You can go through it. Okay. You can customize a notebook LM through the Gemini and you can put your own these things. All these things you can see. These are all the notes I have made. You can see in the right studio part, no? So what you should do, you click on these three and convert all into one source. It will become one source. Okay. So what is the purpose of making into one source? So that this you can use it for making a quiz or to create any studio part. Okay. See, now let us go to a cinematic video that I have done to save that time.
Look at these pathogens trapped in this hourglass, representing our daily diagnostic deadlock. Dengue, enteric fever, and sepsis overlap clinically, making physical diagnosis impossible. Cultures require 72 hours. As wait time piles up, blind empirical treatments fuel India's escalating antimicrobial resistance crisis. The COPID KTK 2026 framework addresses this by applying artificial intelligence as a mathematically precise diagnostic lens. It organizes the workflow into 3 pillars: see, decode, and predict. This framework is designed to support, not replace, your clinical judgment. It provides the tools to safely collapse the timeline from first symptom to targeted therapy.
So all of you are happy with the video? So you can give a prompt. So what is the prompt that I have given? Just I will copy it and paste it to your chat box. See, speaker Dr. Deepak Chiradoni. Topic is revolutionizing infectious disease in diagnostics in AI. Focus. So and so. I want to present in COPID, that is our pediatric infectious disease conference in Karnataka, in English male voice only, but it has given a female voice. See, that is why I made you. This is a one caveat which is there. So many times I wrote to Gemini, Google, but they are not listening to me. Okay, this is the chat box that I have sent in the chat box. So this is the video. Now let us see slide deck, whether it has been a slide. See here, I think this is an infographic. See why infographic is useful. Anybody? Dr. Gauri, Dr. Sridhar, Dr. Gunasingh, Dr. Kalyana Center. Why infographic is useful in our medical field?
It catches the attention and it's easier to interpret.
Yes. Yes. So all your topic is made into simplified into one, and you can just put your flyer one day before, so that they will be knowing what are the things they are going to touch upon and you are going to them. That means you are priming your learners or your conference delegates to make them. And also, if you do it in a practice for any bronchial asthma or anything, for a teaching material, you can do infographic or a video. Especially I used in pediatric pulmonology. Today I sent some videos how to use this meter dose properly, how to use the canister, how to clean the spacer. So you can be with them by sending their videos to their WhatsApp number, especially adolescent with poorly controlled asthma. You can get these videos. Okay. I think, what is this? This is some notes that I have taken. See, this is a AI alert flag sepsis 4 hours. I made it as a notes. I thought there is some good thing here. I made it as a notes and I have taken sepsis early warning system. So the one best part about this Gemini notebook LM is this studio part. Okay, this you should remember. Now I'm going to show the slide deck part. Let me see today's. Yes, slide deck is ready here. So just you can enlarge here. See how beautifully it has made. Internet is a little bit slow. See, it has given presented by Dr. Deepak Chiradoni, Smart Hill Nexus, Random Forest. So it has followed my prompt. Okay. So now we are going to play this. So you can see, just I am shifting this. See how beautifully it has made slides.
Excuse me, sir.
Yeah.
Sir, if we want to make some changes in this slide, suppose we want to change the format or this thing, so how can that be done?
Yes. I'm going to show you that. That will be. This is a common question that we get.
Right.
Okay. See, for that you have to click on this revise button. You have to click here and you have to give a prompt. What changes you want to make? Okay.
Okay, sir.
What is the prompt? What changes you want? You let me tell me. I'll type here. Or it is also suggesting center the image.
Okay. Yeah. Okay.
This is a giving a hint in the slide 9.
Okay.
Okay.
Right.
I want
This slide we want to make it less cluttered or less of
image.
images.
Make it more easily understandable by a medical student. Let us see. Okay. Click on the generate button. So now it is started generating. So this is how you can edit each and every slide. Any other doubt?
No, sir.
Can you please once more tell where exactly to click to edit it?
Yeah. So go to this slide deck. Go to this enlarge button. This revised. You can see here the top revise button. Yes or no?
Yeah, yes. Thank you.
If you click here, so what changes it is asking? Got it?
Okay.
So you have to spend little bit time. So you can download this as a PDF. You can download this as a PowerPoint. Earlier this option was there. Now it is there. So why you should not do PowerPoint? Why you should always download it in a PDF? Anybody? What is the difference? Why PDF is preferred over PowerPoint? Because in Gamma presentation, I told always better you have a PDF as a stand, better not with a PowerPoint, because the fonts which are there with the Gemini notebook or Gamma
Space is
will
less.
not be, not space. The fonts which may not be found in Microsoft PowerPoint. It will come abnormal, figure made distorted. Whereas if you give it in PDF, it will be there as it is. But only caveat with PDF is you do not have a slide notes or a speaker notes. Okay. See, now this is a revised one. 1 minute ago, I told it to the slide 9. I told no. Let us go to slide 9. See, now it has changed. Earlier, this was not there. So this is a distribution of colony type. This is a review of suspicious morphologies. So you can play around with all this studio part. You can do quiz. When it comes to research, Dr. Rihan Yakub is going to show you about how to use the data table, okay, how to make the Excel report. And this is the one very beautiful thing, mind map. Okay. So I'm going to, you can give a prompt, don't give a prompt, just because it will do it very fast, mind map. It won't take much time. So mind map is very good if you are doing a presentation step by step. Okay, algorithm it is going to show you. Okay. It is going based on these 5 sources, it is going to make the mind map. So by that time, let us come back to the previous my notebook LM. Let us see, I have done a mind map of anything. Some pediatric nephrotic syndrome I have taken. I made an infographic, I made a quiz. See, this is a mind map. Nephrotic syndrome mind map. You can enlarge it. See, for presenting for a conference or anything in your this thing, better through notebook LM only you have to do, because internet is very much needed. So if you click here, the part of childhood idiopathic nephrotic syndrome will come. So this is how you are going to tell the students. So what is the classification of nephrotic syndrome? What was the clinical triad of nephrotic syndrome? Here it ends. Then comes the treatment response. Then comes the relapse pattern. So this is a clinical mind map. You can take a screenshot and you can take a PowerPoint also. Okay, you can download it. You can share it. You can put it and you can lay it. You can give the feedback also. This is also one of the very powerful aspect of notebook LM. So if you want to do it in a conference, better do it with the notebook LM only. Okay, don't download, because if you download it, it will be in a small PDF form or a PNG form. It doesn't look good. Okay. See, I made a quiz. See, according to the KDIGO, that is a kidney disease, infectious disease organization, which clinically finding required to define in serum available. So macroscopic hematuria, presence of edema, combination of proteinuria, urinary protein. So you choose anything. If you choose this, this is a wrong answer, this is a right answer. So you can ask Gemini to explain. Again, it will go back to the, see here, it is going to explain you here. And it is going to give you the source. So this is how you are going to play around with the notebook LM. So let me come back to the our AI assisted today's topic. See, mind map is ready. See, we have a microbiology in artificial intelligence and healthcare. So in that we have bacterial culture application, bacterial colony count, AI model evaluation, clinical innovation, governance and regulation. If you click here, yesterday I told you, DPDP Act, SAHI, that is Strategic Artificial Intelligence Healthcare Initiative Strategy from IIT Kanpur and all, both, it is not both, it is both. DH, it is Digital Health Technology, CDSEO and SAMD. There is some small mistakes are there here. This is okay, negligible. Then come, what are the clinical innovation in this resource paper? Portal pediatric imaging, next generation, NGS, advanced therapeutics. If you click on this NGS, what are all the types of NGS? Culture-free diagnostic, infectious, Oxford, Nanopro. Advanced therapeutics, synthetic fast therapy, that yesterday I was telling, synthetic fast therapy to kill the bacteria, Stanford ARC genome design, precision infectious disease medicine. See, that is how this mind map you can do it. Any doubt, friends, regarding this?
No, sir.
Very good. So you learned how to go to Notebook LM or Gemini Notebook. What is the research source part? What is chat box? What is studio? So how we have to go proceed? Start from the resources. Be selective in your resources. It should be very much to the ground truth. Okay, that is very, very important. So if you have a lot of articles, you make summarization using the chat box. Talk to the paper. Find out the research gaps. What are all the deficiencies in the diagnosis? Okay. Then you use this studio to send it or share with your collaborators in your college or in your other college and see what are all the newer uploads are there. Say, for example, I have done a study. Yesterday I told I am planning, because we have influenza A and B with severe cases, only 2 shots of dexamethasone or hydrocortisone initially to the admitted cases, those who are positive for this in influenza panel, and how far they are early they can discharge without using. See, that is a now study that I have taken from last few days. I will upload this paper into this existing papers. Again, I will discuss, then I will make a report here. I can do data table, I can do reports here. See, it is going to ask type of your own report, briefing the document, study guide, blog post. See, all these things, 2 things I have not touched you, because this we are again going back to in module 4 in academic research and manuscript, we are going to show you this. Okay. I think infographic is a very simple thing. So you can ask this notebook LM in whichever language, it will give the infographic, whether it is a concise, standard or detail. So depending on that, you can choose it. Whether it will be in various forms like this, you can choose it and it will generate. You can give a prompt also. Tell your name, you should be in the footnote, it is going to give your name also. Your academy name, it will give. So ChatGPT is also good in infographic. Only difference is here you will have a ground truth resources. Okay. So I think this is how you should use Notebook LM. Sharing also is a very easy. You can make it a private, you can collaborate it. Okay, just like Google Drive, any of the link you can send or make it public. Okay, you can allow to copy the force. You can just copy the link and share it in the chat box. You want to share in your random forest. See, it is coming here. So shall I think Notebook LM, all your clarity is good? Let me stop sharing my slides. Dr. Mariam Yusuf, are you there? Dr. Sunita?
Yes, I am.
So how did you fail this Notebook LM?
I had a challenge, so I couldn't really follow. So it looks like I may have to rewatch the video.
Actually, I've done very slowly, step by step. Anything you feel difficult that I have done very fast, Dr. Mariam?
No, I'm talking about for the Gemini notebook.
Yeah, that is what I'm telling. Gemini notebook, earlier it was to call Notebook LM.
Yes. I'm on it, but yeah.
You
I'm on
watched
it, but
the
I didn't
videos.
start to.
You watched the
Yeah.
videos. Okay. Dr. Kashmiri, can you unmute and tell me any difficulties?
No, sir. No, sir.
Dr. Somashekar? Okay, I think he is Dr. Alexander. I think you are in the medical college. You are in the research. I think you have to. You should be using this.
Sir, sorry. Actually, I joined just few minutes ago. Let me have a look
Watch
at the
the
video
video.
tomorrow on that. Yeah, yes.
Okay, no problem. Dr.
Yes,
Ramesh sir.
I was in my clinic. I couldn't able to.
No
I will
problem.
have a
No
look
problem.
at your video, sir. Thank you.
Okay, interact in the WhatsApp group.
Yes,
Dr.
sir. Yes, sir.
Kalyan sir.
Hello. I had used it,
Ramesh
this.
sir, please.
Hello.
Yes, sir. Yes, sir. Anything you are not followed, Dr. Ramesh?
Deepak, I have followed everything. I don't know how far I am going to do it. That's I have to
You
try
have to
it.
try slowly, Dr. Ramesh. Anyway,
Yeah.
you are coming to Shumaga, no?
Yeah.
You sit with me half an hour with laptop. I will teach you.
Sure. I will be there.
You bring
I will
your
be there.
laptop after your presentation. You will be with me in my room, no? Anyway, Sunday you will be there after the conference. You sit with me. Okay, I will teach you.
No,
You
I
can watch the
learned
videos
so
whenever you
many
are
things.
free.
So many things I have learned. I don't know how far I am going to do it. That's my
No,
doubts.
you should do it. You should do it. This is not a big thing. See,
It's a
when WhatsApp
fantastic.
came, when smartphone came, nobody was using. Now smartphone is essential.
It's a fantastic this because to make a slide for my presentation in Vasicon, I took so lot of time, but you made it things easy.
You
I
try
should
with
have
it.
known this by the before only.
No, when is your talk, Dr. Ramesh? Sunday, no? Morning, within 10 minutes, I will make you slides and give. Just see contents are good. Huh? If you have it in
Okay.
PDF, if you have it downloaded, you give me the sources, I will make you the PPT.
No, I have made my PPT. I'll show it to you.
Yeah. So, Dr. Raju, sir?
I had used this notebook LM previously, but I think I was using it only in a crude way. Now I can refine how to use it, and so I can prepare better slides with this.
Yes, sir.
Was excellent presentations.
Thank you. You have to go in depth. This notebook LM, you can use it left and right in your practice. Especially those who have got a clinic to generate health educative materials, you can do. I'm going to share you in your WhatsApp group all those I told you, difficult asthma management, how videos are made, okay, without spending much. So those who are in allergy chapter, all these things you can give it to the patients in their own language, so that patient should not go to anybody else. They'll be so happy. So all these infographics, audio podcast and all, they'll be very, very happy. I think with this, we move on to this very, very important aspect of today's, that is CDSS, that is Clinical Decision Supporting System. So I'm going to share my slides again. No slides, all demo only. So open your WhatsApp. Okay. Open your WhatsApp, Random Forest. I have a case scenario here. You can see my screen. Six-year-old girl developed fever. Okay, all of this you can read. I'm just copying this prompt. Okay. And we have some lab reports. So with this, how we are going to analyze this case by using this artificial intelligence. Okay. So this I'm putting in the chat box. Even you can copy from your WhatsApp also if you are connected with the web. I think I copied the wrong prompt. This is a chat box. Yeah, this is the only. I copied it. Now what I will do, so let us go to ChatGPT first. Okay. Take a new window. So now I am pasting this prompt. Copy and paste. So 6-year-old girl developed fever on 7th and 8th of August, which is persisted approximately 10 days. Fever was high grade during initial 4 to 5 days, moderate grade for next 5 days. During the illness, she developed watery loose stools 5 to 6 times per day without blood and mucus, bilious vomiting 4 to 5 days for 2 days. So jaundice noticed during hospitalization. Girl was toxic, high CRP was very high. Okay. Antibiotics, cefatoxime and meropenem was started outside. There was a gross hematuria for 2 days after admission. Afterwards, the urine became clear. There was a periorbital bilateral lower limb edema for last 2 days only. Pitting edema over the legs. Moderate pallor and the report was assessing 6.5 to 7 grams per deciliter, which was maintained throughout the illness, now 15 days. This is a morning case that we know. There was no thrombocytopenia. Okay, all the investigation that I have attached to you in your this thing, you can just look at your WhatsApp. See, this is the hemoglobin, all those CBC report. This I am downloading. Okay. Just I will read it as report 1. I will attach the chat GPT. This is from the WhatsApp I am copying. Report 2. There is one more report. Report 3. Yeah. So these are the reports. The ultrasound report also that I am going to post to you. Let us see. I will attach this report. Add photos. Go to the downloads. So I am attaching these reports. 1. Second one. Third one. So here I have not relieved the patient name. I have not relieved the mobile number, address. That is the personal health data protection has been maintained here. That all of you should follow this. This is very, very important. Do not put the address, everything. Okay. Remove the symbols and all. Maybe he has done through ChatGPT, Dr. Mahesh Kore. Let us evaluate with this finding. Okay. Now, let it take time. Now we come to the my favorite model, Claude. So I copy this prompt. I just paste it. Again, I'm going to attach the photos. These 3 photos. And select the model. I'm selecting the best model, Opus 5. Okay. Give hit button. Let us see. Chat GPT. Yes, it has answered. So this is a severe kidney stage 3 AKI until proves otherwise. My leading differential is infectious associated severe sepsis or acute tubular, probably the strongest broad mechanism. She has a prolonged high fever, CRP of high. Okay. Then chances leptospirosis. This is my high list. Why? It has given a reason. Prolonged fever, vomiting, diarrhea. Suddenly she has presented with hepatorenal symptoms. Hematuria. So all these things. So it is not only giving you the hint of the diagnosis, but also why it is choosing. It is giving this thing, and it is giving the reference also. So ChatGPT has given the references also. Okay. So absence of thrombocytopenia does not exclude leptospirosis. Okay, I would send LGM leptospira PCR. Then comes the AGN or infectious related glomerulonephritis. Why? Because of this. Then comes HES. That is hemolytic uremic syndrome. Okay. So these are all the differential diagnosis it is giving. Now, it is giving what is the possibility. My impression, lepto associated with AKI, sepsis. So it is streaming down the diagnosis. Okay. So much detail it has given. Okay, let us see how Claude has responded. So, good case, thanks for the details. So, here how I will read. So, it is given date by date. Okay. So, what is for against lepto? What is against lepto? What is for scrub? This is one way of giving reasoning. So, whichever is the thing which is best for you, you just copy it and take it down. So it is asking again one question that reframes everything. It is a gross hematuria, or it's a true hematuria, or a pigmenturia. That means some hemolytic jaundice, or it is due to some insult due to some drugs. We used to see this type of cases after nimesulide or mefenamic acid, which is widely used. I see a lot of these types of cases. Fortunately, no kidney injuries or anything. Here, the blood urea creatinine was very, very high. And CRP was very, very high. These are all very, very important thing, which was against the drug-induced. Only sole. It is an infection plus drug-induced kidney injury, which is transient with fluids and very proper monitoring. You can combat. And so, what are the investigations should I send today, which are not done? So, the urine question first. Routine microscopy, infective workup on lepto, as ChatGPT said. Okay, it should be paired sera. Scrub typhus is also very, very common in North Karnataka. Malaria, typhoid. One against thing about typhoid is there was no eosinophenia. There was a little bit of eosinophils, 8%. This was against the typhoid. See, this is how you should do clinical diagnosing supporting system. You have to compare to the models. and it is telling if creatinine doesn't start trending down within 7 to 10 days, you should consider C3 low for complement deficiencies or anything, or kidney
Sir,
injuries. Because
excuse me, is it the mobile? It is not coming in detail. The same Claude
mobile,
or
it will take Card Pro, it will take little bit time. That is why I always tell you better to use
this.
a personal computer.
Okay, yeah,
You can
yeah.
do
I
it
think.
later, sir, because everything this case will be shared, already shared. You can do it with various in your computer.
Okay, okay.
So you
No,
have to go through this, okay, and you have to tell this, okay. Now you go to the next model that I'm going to tell you. This is called glasshealth.ai. Okay. This is a electronic medical record. Okay. Don't take this one. Glass Health you can type. Glasshealth.ai. Let us see.
Perplexity or what?
Now this is my Perplexity browser comment.
Okay.
It is do Perplexity search. Okay. So this is an app for your this thing. I am not bothered about that. I need the Glass Health. So if it gives like this, no, what you can do, you can take another browser called your Google browser. Okay, let us research through this. So just type Glass Health. For clinician, you can choose. This is one of the best EMR that I have seen. Though it is a very costly, I'm not having. Okay, you have to sign up. Okay, through your email account. I will continue through my Google. Okay. Okay, I'm going to sign in my email. Just I'm putting my password. Let us see. Okay, I will log in from another account. There is some login issue. I'm very sorry. Let me see what password I have put. By the time you can relax for 2 minutes. No, I'm not getting. We'll sign up new with. You can also sign up by the time. Okay, come back. Yeah, now it is open. See, this is the home page of Glass Health. All of you are there?
Yeah.
Yeah.
Yes, sir.
See, now, this is where you can do scribing. You can use audio scribing also, voice mode, or you can type it also. See, I will copy this prompt. That I have given to the chat GPT. Okay. In the Glass Health. Okay. I can add a context also. These 3 reports. Okay. So you have this EMR with this. Now you are clicking here. So you have a case with attachment. You have a chat window here and canvas here. So you want a differential diagnosis here. Okay. It is uploaded, each and everything. It is asking differential diagnosis. See, now it is giving differential diagnosis. So it is generating. So you can draft assessment and protocol notes. You can draft clinical note. You can draft history of presenting illness, progress notes. Okay. What is the discharge summary, instruction, each and everything after visit, patient handout you can generate. This is a completely enabled. So this is a summary. What is the hospital course? Okay. Now I'm clicking here. It will take little time to give. See, it is doing now. See, this is a case discussion. What is the most common diagnosis? Infection-related glomerulonephritis, potentially crescentica rapidly progressive, or sepsis-associated acute tubular injury, mixed acute kidney injury due to infections and tubular necrosis. It is telling Shiga toxin also with HUS. See, such a depth it has gone. See, this type of EMR you need, and it is giving you the references also, consensus-based recommendation. Okay, consensus is one of the AI tool. It will search 250 million articles. Okay. See, with the references you have, all of you are following the last health AI?
Yes, sir.
Yeah.
Yes, sir.
See, this is one part. Now I will take a new chat. So I will create one patient. Okay. This is a new email. Say, for example, you write Deepak. Last name, Chiradoni. Date of birth. You choose whatever you want. Okay. Sex. Okay. Write 1110. So save patient information. Okay. This is the patient. You can connect it to the EMRs of your own choice. Okay. Now you close this window. This is the main window. See here, I am not typing anything. Just I am start scribing. Hi, I am Dr. Dhruva Chiradoni. I have got Deepak Chiradoni patient who has a cold, cough, fever, headache, vomiting since last 3 days with the chills and rigors for last 3 days. And he has been given paracetamol. For that, only 1 or 2 hours fever is subsiding and it is not coming down. And there was a history of the similar cases in and around these places. And they are brought there in the hospital for severe hypotension, severe respiratory breathlessness, hypoxia. So what could be the common causes? Thank you. See here. See, this is the things that I have told. Okay. So it is going to give you the differential diagnosis with this. So this is a 36-year-old man. This is the hospital course. Next, you can ask drafted differential diagnosis here. So it is going to think and give you the differential diagnosis. It is going to give you. See, it is analyzing. Okay. So by the time it analyzes, what is the cost of this Glass Health AI? See, I am using the free version. So $90 per month is the cost of this. I don't take this. This is just to appreciate how the electronic medical record should be there. We have a separate session on electronic medical record. We have our Indian demo also. But what I am telling, why I am showing this as a clinical decision support, because this is one of the, because I have done more than 100 EMRs enabled. This is the one which I find it is very, very ideal for a clinician, clinical pediatrician who needs. Okay. In US, you can connect it to, these are Athenizer software, just like Axon software, what you have, Eka Care, Health Ray. These are the two important softwares in US. It has you can integrate it. And I'm very happy to tell you that one of our faculty, Dr. Pratichi, in the last module, she is going to come and show you about PPT. She is going to tell you about, she is going to do an association with Glass Health with her. So she may bring out a good clinical intelligent electronic medical record. So friends, any doubt regarding this Glass Health AI?
Very interesting, but very costly.
No, see, everything has a value, no?
Yeah. No, but really good.
To learn, no, see, so many times it is there. See, if any vendor comes to you and ask, what are the things should any EMR should have? These are the things you will get the idea, na?
Absolutely.
You have after visit summary is there, discharge instruction is there. See here?
Yes.
See, everything has a value.
Absolutely.
Each and every paisa you spend, no, but you get that idea. You tell the vendor, "Hamara people जुगाड़ करते हैं. Chinese and Indians we do it." But you should have that idea, na?
Absolutely.
That is very, very important. That is why I showed you this Glass Health thing. So you can create 5-6 email account and you can use it freely. Okay.
Right, sir.
So you can do, again, follow up these cases. You can make it as a project also in Claude, even in ChatGPT. You can always think about this case and evaluate these cases. Okay. So friends, I think now it is 10:55. So this is a very, very important aspect of artificial learning. These are the things every day you people are going to do it. Any question, Dr. Mariam, Dr. Alexander, Dr. Raju Kalyan Shettar, Ramesh sir, Nitin?
No, nothing.
No, I've downloaded the app.
No, you can do through your browser, madam, Dr. Mariam, from your Google browser or Firefox.
The Glass.
Yeah, glasshealth.ai.
Yes,
You can download it to your mobile, your laptop as an app if you are an Android user.
Yes.
You can just try out. See, my aim is to give you an idea. It is how you proceed and ask your vendor in your Nigeria, say, I want this type of software, or the government, recommend the government. This is the ideal software. You develop this type of software and give it to me.
Okay.
So you should demand. To get that idea, I showed you this glass.health. Okay. Why I showed you? Because after the next class, there is a demo session of AI models from various softwares. Initially, I will show you traditional software. Then 2-3 AI assisted softwares they are going to demo. You should be able to ask the question to those model. I am not going to show the model. The people from their model developer, they will come and show you in the course. You should be able to ask the question, see, this model you don't have these features, this model you have, so you update it and you can come to me. Okay, to get the idea, you should use this Glass Health here. Okay. Any other doubt for this, Dr. Kashmiri?
Sir, what is the popular in US or Europe? Because I think the Glass Health didn't give the differential diagnosis of leptospirosis. Other two gave leptospirosis as a first diagnosis.
See,
So,
that is why, Dr. Gunasingh, you are absolutely correct. See, that is called demographic shift. Okay.
Okay.
These models are trained in US based.
Okay.
See, that is why you should ask a follow-up question in glass.a. I am from rural India. That part that was
Okay.
not there. Because Claude and ChatGPT, why answered? Because I was using day-to-day day notes since last 6 months to 1 year. They know Dr.
Okay.
Deepak is from rural India. It doesn't going to go.
Okay.
That's called AI consciousness. It is like your spouse. Okay, Dr. Gunasingh.
Okay. Okay.
Once you
Okay.
use this ChatGPT and Claude, now they will get association. Glass Health, I am using this free version to show demo purpose. That's all. Now I think you got the idea.
Okay. So that's
Any
why
other doubt?
I asked you whether they have a memory. That's why. So they
No,
have a
memory will be
long-term
there.
memory. So
Once you take a premium version of Glass Health, definitely it will be. I think Dr. Pratichi Mishra, she is a AI model developer. She is one of our faculty. She is going to tell more about Glass.health. They are so liberal for India because they want the data. They may commit and give it for a free for us also. Okay, give us some time. But I think for Dr. Gunasingh, I think Notebook LM is a very good tool for academic research, teaching, making quizzes, making posts, all those things you can do. For you, Dr. Alexander, Dr. Kalyana Shettar, because you people are in teaching.
Yeah.
Yeah. So any other doubt, friends? So we almost test 11 o'clock today again from 9 o'clock. That's good. Recordings tomorrow by night I'm going to send you. So Sunday will be Dr. Samir Shah and Dr. Mamta Panda. They are taking you one more important aspect, how to use this chat GPT, how to create a custom GPT, how to create a custom prompt for generating discharge summaries. Okay. Day-to-day vaccinology, nutrition. Okay. All those things, and how to use this Google Notebook LM to create good videos, asthma and all, because Mamta Panda is very good in allergy and asthma. So this is also a repetition for you in there also. Okay. So you people ask more and more deep dive question about Notebook LM or Gemini Notebook, Dr. Mariam. Sunday you will be there, no? Dr. Mariam, 5 o'clock to 7 o'clock, Indian Standard Time.
Thank you.
Right, madam. So I think I'm going to end this session. If there are any no doubt.
I saw in Coimbatore, Pedicon, you are having a workshop.
I'm the course coordinator, sir.
Yeah, I saw you. Is it anywhere different from this or same you are going to tell? I thought
it is a mini crash course, sir. It won't be detailed like this. It's a mini crash course. I don't think you can spend another workshop because it will be most of them you will get bored, or you come as a faculty and teach them. That also you can do it. Or you can come and give the feedback.
Okay.
It's a very mini crash course for about 4 to 6 hours.
Yeah.
We are not going to give this much of detail. That is why I always tell takes 5 weeks course as a basics. Because we give a lot of time to you to interact. There we don't have time because everything will be condensed. Because in Kolkata we did now within 2 to 3 days of announcement, all 60 slots were full. Because AI is a hot cake now.
Yeah.
Even Bangalore we did too.
So
these are all the crash course for new persons to come into the academy. Okay. Right.
Okay, sir.
I think anything. So if you like this 2 hours, you put your feedbacks in our Perceptron WhatsApp group. Give honest feedback. Anywhere to improve, anywhere should I make very slow, so that I can in 2027 batches I can make some alteration. Because from you we will learn as a faculty, because you are the people who are precious. Okay. You people will stay till 11 o'clock and listen. That means how interested you people are interested in learning. I think we'll make a adieu. So thank you very much. Good night. We'll meet you again in Sunday. Thank you very much.
Sir.
Bye.
Thank you.
Bye.
Good night. Good night.
Sir. Good night, sir. Thank
Good
you.
night. Good night.
Tomorrow I will send you the link. Bye.
Yes, sir.
Bye.
Yes, sir. Bye.
I'll make the show
Thank
end.
you.
Okay. Bye.